Vertigo, a feeling in which the external world seems to revolve around the individual, or in which the individual itself seems to revolve in space. Types: central and peripheral. Signs and symptoms: peripheral vertigo, dizziness, problem in focusing the eyes, hearing loss in one ear, unable to balance, nausea, vomiting. Signs and symptoms in central vertigo: double vision, slurred speech, difficulty in swallowing, weak limbs, facial palsy. Investigations: caloric test. Principle: to induce nystagmus by thermal stimulation of vestibular system. Types: modified Cobrac test. The patient is seated with head tilted 60 degrees backwards to place a horizontal canal in vertical position. Ear is irrigated with ice water for 60 seconds, first with 5 ml, and if there is no response, 10, 20, 40 ml of water. Normally, nystagmus beating towards the opposite ear will be seen with 5 ml of ice water. Fitzgerald-Hallpike test. Patient lies supine with head tilted 30 degrees forward so that horizontal canal is vertical. Ears are irrigated for 40 seconds alternatively with water 30 degrees and 44 degrees, and eyes are observed for appearance of nystagmus till the end point. Cold water induces nystagmus to the opposite side while hot water induces nystagmus to the same side. Cold air caloric test. It is done when there is perforation of tympanic membrane because irrigation with water in such case is contraindicated. Electronystagmography detects both spontaneous and induced nystagmus. Depends on the presence of corneoretinal potentials. Optokinetic test. Patient is asked to follow a series of vertical stripes on the drum moving first from right to left and then from left to right. Normally produces nystagmus with slow component in the direction of moving stripes and fast component in the opposite direction. Rotation test. Patient is seated in revolving chair with his head tilted 30 degrees forward and then rotated 10 turns in 20 seconds. The chair is stopped abruptly and nystagmus absorbed. Normally there is nystagmus for 25 to 40 seconds. The test is useful as it can be performed in the cases of congenital abnormalities where ear canal has failed to develop, and it is not possible to perform the caloric test. Galvanic test. It is the only vestibular test which helps in differentiating an end organ lesion from that of vestibular nerve. Patient stands with his feet together, eyes closed, arms outstretched, and then current is passed through one ear. Normally, person sways towards the side of the anodal current. Posturography. It is a method to evaluate the vestibular function by measuring postural stability, and it is based on the fact that maintenance of posture depends on three sensory inputs: visual, vestibular, and somatosensory. Psychological support, pharmacotherapy, drugs like diazepam, lorazepam are given. If it is associated with nausea or vomiting, metoclopramide is also given. Adaptation exercises, intratympanic antibiotic injections, surgery. It may be conservative or destructive. These are the exercises for management of vertigo. Thank you.